Hello,
Hi.
am I audible? Am I visible?
Yes, yes.
Perfect.
All okay.
Great. So let's get started. I'll just quickly introduce to people who've joined in and we'll get started with that. All right. Let's. Okay. Hey guys, welcome you all to the brand new episode of Charak Adya. This is Dr. Sejal Jain. Charak Adya is an initiative by country's Ayurved leader Charak Pharma. These are series of live Instagram sessions where we talk all about women's health and wellness. Today's topic is how do we optimize women's health and wellness in simple ways. And for that, I have a guest, Dr. Purandare, who is an eminent and renowned gynecologist with rich 20 years of experience, and he's a multi-talented doctor, I must say, and passionate about cricket and photography, right?
Yeah.
Great, great. So we have
So,
something in common for sure: medicine and photography. All right, doctor. So we have penned down few questions, for these topics, what we generally listen and really want to know about. So shall we get started with that?
surely.
All right, all right. So, like, my first question for you would be, what is good health, and why should women be vigilant about their healthcare needs?
So, I think you know that God has blessed us humans with phenomenal brain, beauty. I'm seeing one in front of me, and the power to emote and the power to do so many things. You know, but we'll be only able to do all this if we have health. And in fact, the father of our nation, Mahatma Gandhi, said that health is the greatest wealth. Don't go after gold or silver, go after health. If you have health, you have everything, you have power, you have knowledge, you can do anything. The sky is the limit. And therefore, there is the concept of health and wellness. So,
Yeah,
what is basically health? Health is basically when your body, mind, soul, everything functions positively and productively. And what is wellness? Wellness is a sense of this. When you feel that you are healthy, when you feel that um, you feel happy, you feel healthy, you feel positive, and there is no disease around. So I
yes,
think in today's world, when all of us sometime during the day have some negative thoughts, we need to push away those negative thoughts and think positive, think healthy, act healthy, be healthy, eat healthy. So all this is what is called as lifestyle. I think you're a lifestyle blogger, and I think that's why health and happiness are the key to human life in today's world. They were there in the past, but more so in today when we have so many stresses in our
correct.
lives. So that is what is health is all about. Now you will wonder if why do we need doctors in this world? Uh, we need doctors because there are times that the body will deviate from its normal functioning or normal health. And this is where doctor, your friend, comes in. Your friend in need is a friend indeed. And so your doctor comes there, happy to help you to ensure that your body is right on track and you are back to being your best self.
That's amazing. Superbly defined, actually, how this is important. All right. So, but what are the common issues, and what are the common health problems women in India face, and they come to you especially as a gynae?
Yeah, so we must remember that there is a plethora of problems women face.
Yeah.
I'm a gynecologist, so I'll mainly deal with the gynecological problems, but
Yes.
those are interrelated with other issues as well.
Mm-hmm.
I must confess to you that women are shy to seek help as compared to men, especially about their gynecological problems. It's only when they really feel that
They can't
things
do
are not
anything.
working, yeah, things are not working out, that they reach out to the doctor. So it
That's it.
depends upon the woman's phase of life. To put it simply, every woman is blessed with a different phase of life. First, you're a daughter, then you are a student, then you are maybe a fiance, then you are a wife, then you are a mother, then you are a mother in law, and This is how you are a daughter at times. This is how the woman has different roles. And when she is playing these different roles, she has different health problems. So they could range from, in younger life, things like period problems, uh, things like hormonal issues. Later on in life, it could be because of trying to conceive, then pregnancy. Uh, it's a unique phase of every woman's life. Every woman remembers it, wants it to be a memorable and a pleasurable event. And then later on, as the woman ages, she wants the security, she wants the positivity to endure those elderly phases of her life. She wants attention, etc. So there are different issues. And maybe in the course of the next half an hour, we'll focus on some of them so that we can address them specifically and more importantly, practically, you know.
Yes. So the first question I would like to discuss in this is like anemia. Anemia is very common in women, especially middle age or even younger age nowadays, and elderly for sure. So how should we correct it with diet changes and herbs? First of all,
Okay.
how common is
So
anemia?
it's a very, very important question, Sejal.
Okay.
Right now, I think anemia should be our top priority for women's health. We are talking about having Corona Mukt Bharat, but I think what we need to have is Anemia Mukt Stri in India.
Oh,
Anemia, you may find it strange, is present in almost 80% of women in India,
oh my God.
irrespective of whether they come from urban or rural areas, whether they come from rich or poor, whether they are young or old. So it's that high and that prevalent. Now you'll ask me, Doc, then how don't we know so much about anemia? It's because we don't test enough. So
Yeah.
every woman, every girl should take upon her that she should get tested for her hemoglobin. It's a
Yeah.
simple test, it's a cheap test, okay? And remember the mnemonic, by the age of 12, your hemoglobin should be 12. So 12 by 12. If we are able to ensure that the girls have enough iron and enough hemoglobin, this girl of today will be the mother of tomorrow, so she'll go through pregnancy easily. Now, why is anemia so important in women? You know that every woman has the physiological event of periods every month, and periods is a form where bleeding occurs, some amount of blood loss occurs, and therefore there will be some loss of blood leading to some depletion of hemoglobin. But strangely enough, the most common cause for anemia is not the blood loss from periods. It is dietary deficiency, like you rightly said, of iron in our diet.
Yes.
Most of us in our country, we are vegetarian, and therefore we have relatively less iron-rich diet as compared to a non-vegetarian person, where the non-vegetarian food has more iron vis-a-vis the vegetarian people. What we must remember is that if you have a iron-rich diet, and especially iron-rich diet in which you eat jaggery, you eat green leafy vegetables, and you have amla, which is vitamin C, because it increases the absorption of iron. Now, in today's generation, if I told you to eat all this, they want to go to your channel and see the best kind of food platter that you offer, the most decorated one, the most exotic recipe. And if I could give you something which is ready made available, which guarantees you natural source as well as which ensures that it is scientifically correct and will get absorbed effectively, you would prefer it, isn't it? Convenient. So we do have from Charak something called like it's called as Manol, which is a nutraceutical,
Okay.
and this syrup is very good. I think we should need to take this and emphasize it to all women. If they are able to build up their iron stores, pregnancy will be easy, infections will be less, and overall their activity both in mind and body will be more, because iron increases hemoglobin. Hemoglobin delivers oxygen to all our tissues. If there is more oxygen, our body will function well and superb.
Awesome. So moving on from anemia, there is someone who asked also about hypothyroidism. So that is also very common. Thyroid issues, T3,
Yeah.
hypoTC
So
going on.
so uh, somehow or the other, the thyroid disorders are more common in women as compared to men. And you have a spectrum of disorders. On one side, you have hypothyroidism, that means less thyroid hormone is produced in the body, and you have hyperthyroidism, where more thyroid is produced. Hypothyroidism is more common in our country as compared to hyperthyroidism. And hypothyroidism has more consequences on women's health. It can lead to irregular periods, it can lead to infertility, it can lead to pregnancy loss. But more importantly, it is shown that if the woman is hypothyroid in pregnancy, there is a small chance that the baby may be also hypothyroid and it may affect the baby's brain and IQ in the future. So every pregnant woman should get a thyroid test in pregnancy. And if your doctor tells you that yes, your thyroid level or your thyroid hormone is low, you need to take the thyroid medication regularly on a day-to-day basis. So it's very important.
That's amazing. So I would like to
Iodine deficiency is the commonest cause of hypothyroidism in our country. We do have fortified salt or iodine rich salt. All of you all are aware. Okay,
yeah,
they say no namak, fortified namak. So we must consume that. I'm sure all of us do consume it now.
that's great. I would like to tell you to just because your chin is getting cropped. So if you could just go, yes, perfect. Now I can see you properly and others can see you. Amazing.
Yeah.
All right. So that's about thyroid, hypothyroidism, I think. And next, because there's so many topics we would like to brush on, and get knowledge as much as possible on all the things asked. So the next thing is about PCOS. I know it's a very vast topic, but I would love to, brush it on, like how common it is and what simple tips we can give it to our audience to manage it.
Yeah. So I think it's very important that you took out the topic of PCOS. And I was fortunate to do the first community-based survey on PCOS in adolescent girls in Mumbai, in Sivri. Okay. And this has been published in medical literature. We did screen adolescent girls and we looked for PCOS. And you would be surprised that almost close to 50%, that is 1 in 2 adolescent girls, had some form of PCOS. What we strangely observed here is that these girls were more obese, these girls had more irregular periods, and even some of them had hypertension or blood pressure at a young age. So, therefore, we look at PCOS with the 3 F's, that it affects 3 things. One is your figure, because you tend to become obese and fat. Second is your femininity, because there are a lot of cosmetic issues, acne, hirsutism, hair loss, etc. And the third is fertility. So 3 F's. But we need to think beyond that. And according to me, PCOS is the older concept was that it's a hormonal imbalance. But it's not just a hormonal imbalance, it is a metabolic imbalance. And therefore, a healthy lifestyle, a multi pronged attack, that means eat well, exercise regularly, and ensure that you take the correct tablets or the correct medications. Nutraceuticals, some of them are excellent. They are herbal in nature with minimal side effects, and they can also be used. And they can set the body's hormonal clock correctly. And
Okay.
once that is set in and the hormones are properly put in place, all these 3 things will fall in place. You lose weight, your ovaries will start cyclically producing eggs, increasing the chance of pregnancy as and when you want to. And also, your periods will become regular and there'll be less male hormones. And so you won't have more oily skin or pimples or hair loss, etc. So remember the 3 F's that you want to correct: figure, fertility, and your fatness.
Yeah. Okay. All right. So this is fine. But any like PCOS, since it is very common, like there are certain things you need to do to, keep it in control. Like one is thing, of course, I know exercise, but apart from that, what else you can tell our audience, like they can manage it
Yeah. So let's
at
look at
home?
the three ways that we need to look at PCOS. First is diet. You need to avoid junk food.
Yeah,
Okay. I'm sure, Sejal, you have a very, very strict diet regimen in your life, and that ensures that you have such a glowing personality. Behind that, you have a very, very strict discipline in your diet. I'm sure about that.
yeah,
Similarly, you need to be motivated and have a good diet. Avoid junk food, avoid oily food, avoid sugar-rich foods, cold drinks, etc. Eat on time. That is very important. The second is lifestyle. How much ever we deny it, lifestyle plays a very important role in our hormonal balance in the body. More so for females. So sleep well, do some form of yoga. It tones down the body, it relaxes the mind, it sets off the hormones in the correct direction. Do some form of exercise. It need not be heavy gymming exercise, but it should be regular exercise. And by regular, I mean at least half an hour to 40 minutes. Even if you walk for that duration, it will set your body into correct metabolic rate. You will burn off the excessive calories, and it will ensure that there is no adipose tissue deposited. In other words, your fat, you will not put on weight, or you will not put on excessive weight than what is needed. The third thing that you need to do is that you need to check whether your hormones are in place. And for that, you need to seek a gynecologist's advice. They will do some tests, they may do a sonography if you are having any of the symptoms, and then they will give you medications. They usually give you both types of medications, herbal or natural medications to begin with. And in those where this doesn't settle in, usually in half of the cases, it settles with just this simple tip that I told you, that is good diet and good exercise. If it doesn't, then you may have to take medications. But don't ignore PCOS. The earlier you aggressively tackle it, the benefits you will reap not just in your married life, but even in your elderly life.
yeah, that's true.
And it doesn't mean that if you are thin, you don't have PCOS. So we have two forms of PCOS. One is called as the obese PCOS, okay, which is more common. Almost 70% of PCOS is obese PCOS. It's a vicious cycle. Weight causes PCOS and PCOS causes increase in weight. But in 30%, which we are seeing more and more now, even lean PCOS it's called as lean PCOS, and these may at times be challenging because they are not diagnosed early because you don't see. Yeah. So you need to. They also have a hormonal switch which has gone wrong, and so they also require some form of initially a lifestyle change and then some kind of medication.
That's really to be understood and noted. That's great. Uh, all right. So moving on from PCOS, we have another common issue, which is white discharge. Now, sometimes white discharge is normal or not normal. When it is infected, not infected, is we need to really figure out and distinguish between when to seek medication or come to a doctor for that. So please draw some
Yeah.
light on that.
So I think white discharge is a very, very private complaint of women. And many a times I get a call in the middle of the night, doctor, I've got white discharge. Am I going to get infection, or is it something abnormal, etc.? As a healthcare provider, we must be sensitive to this complaint. We must accept the sensitivities of the woman, because white discharge is often distressing. I said often because sometimes it can be normal, because it is normal just before your periods or at the time of ovulation, that is mid cycle. It is normal, it is not abnormal. It's the abnormal discharge which we are worried about, because it can lead to infection. And therefore, this infection has to be properly treated. Now, as you know, the vagina of a woman is exposed to the exterior, and therefore ascending infection from the germs around can affect the vagina. The vagina has got a very good police force, mind you. It's like the Mumbai police, very, very active and very, very competent. It produces acid there and it kills all these abnormal germs and bacteria. But if there is a decrease in the immunity or in a disruption of the environment there, then these acid producing cells, which are called as lactobacilli producing cells, they produce lactic acid. These reduce, and as a result of which infection increases. But we need to treat it because this infection can affect or can ascend into the uterus and tubes and can affect the genital organs and cause infertility and other problems later on. Usually, white discharge is because of three common things. One is a fungal infection, which is candidiasis. The second is a bacterial infection, which is called as bacterial vaginosis. And the third is a parasitic infection, which is called as trichomoniasis. Trichomoniasis is often transmitted around sexual intercourse, and therefore the partner also has to be treated. Now, we do have certain herbal remedies which are excellent in treating vaginal discharge, and the common herbs which do very well are neem. Of course, we use neem for face washes because it's extremely antibacterial. You use lodra and even kumari. And there is, again, Charak has come up with a very female tweaked or female centric preparation called as Femiplex, which does very well, not just in white discharge, but it also helps in symptoms of urinary tract infection like burning during urination, etc. So one must not take vaginal discharge lightly and treat it aggressively because it will not just make the woman feel better, but also it will reduce the chance of long lasting complications. As a woman ages, she also feels dryness of the vagina. And here also certain lubricating agents, etc., are found to be useful. Certain herbal preparations, like I told you before, they also help in restoring these the lining of the vagina which dries up with age.
Okay. So, someone asked, like, what is your take on vaginal washes? You know, you get a lot of marketed vaginal washes. Are they good, or the
Yeah,
vagina is
so
good
there's a
enough to
concept.
do it,
Yeah,
do the job
there's a
itself?
concept. Yeah, there's a concept of what we call as intimal hygiene. Just like how you have oral hygiene, there is something called as intimal hygiene. It's a fancy name, but what it really means is that keeping the vagina clean. And these washes are really good. One must not overdo them. Use them in a diluted form, preferably with very gentle lukewarm water. And if you go from upwards down, that is from the urinary opening to the rectal opening, okay, in a downward flow, that's the right way to use them. They have to be used externally. They can't be used or should not be used internally because they can cause then some kind of erosion, corrosion, inflammation of the vagina. Okay, they're very good products. We must encourage our girls and women to use them because they will reduce a lot of soreness and itchiness in the region of the private parts.
There's also one question on the same lines, that white discharge, about it. White discharge can be due to some deficiency. Yeah, I have
Yes,
heard of a lot of people talking about calcium deficiency or some other deficiency. So, what do you think?
yeah, so it's basically like I told you, a decrease in immunity or a decrease in well-being. So if there is a decrease in well-being, it will lead to an opportunistic infection. All this infection is opportunistic because normally I told you the police force of the vagina is preventing any intruder from coming in. So if that police force becomes weak, we become lax, then the invaders start coming in. And that's why the deficiency, the illness, all that can lead to an opportunistic vaginal infection.
Okay. What about, since we are mentioning also about discharge and menstrual hygiene, intimate hygiene, so I'm just trying to take few questions on the relevant topic what we are discussing right now. What are your views on menstrual cups and also like on tampons. So I know it's a very
Yeah.
women question, but I think the gynecologist can best answer this right now. Yeah.
Yeah. So as far as the cups are concerned, we are much better off now than a few years back as far as the design of the cups are concerned. But whenever we are using cups or tampons, we must ensure that they are used hygienically and removed in time. Because with the tampons, medical history tells us that they were one of the first sources to cause infections in the reproductive tract, though they were rare when they were left inside for a long time. So if you're using cups, good, clean them at regular intervals, insert them properly, speak to your gynecologist to ensure that they fit properly and they are of good quality, then go ahead and use the cups. If you're not comfortable with them or your body can't tolerate them for whatever reason, avoid them. Use napkins, use sterile cloths. We have now biodegradable sanitary tissues, etc. Please go ahead and use them as well. So I'm open to all of them, but you need to use whatever you want to in a clean and hygienic way.
Yes, very important. Okay. So, do we need to consider a regular checkup for these things? And after what age? Neelam has asked that. Yeah.
Okay. So, an apple a day keeps a doctor away. Okay. And you don't want to see a doctor or lawyer unless there is some crisis in your life, isn't it? But we are moving into now a state of preventive medicine.
Yes.
That means we want to prevent any disease. We want to maintain health. And the best way you can prevent a disease is you visit the doctor not because you're sick, but because you want to check that everything is okay. And how will he do so? He will ensure that you are properly assessed, you are properly counseled, you are properly told about any risks that may be coming your way so that you can modify those risks, reduce those risks. So, if I would say that if there is no health issue, you must visit the doctor if you're young, once in 3 years, in your midlife, at least once in 2 years, and in the elderly age group, at least once a year. If there are specific issues, the doctor herself or himself will tell you to come and see at regular intervals to see whether your issue is worsening, is improving, or is maintained. So follow that advice. Don't take it lightly.
Yes. Very
Uh,
important.
I must emphasize to you. You asked me that what would be some of the the preventive tests. So a Pap smear, which is usually done to check the cells from the cervix. It's a test to check for cervical cancer. It's done in married women and above. A mammography in elderly women as well, which checks for breast cancer. A bone scan to check for osteoporosis because that's the important problem of later on in life, weak bones. Okay, and obviously a thyroid and thyroid and a blood sugar test because you know that these are more prevalent in our women and they can cause multi-organ issues. So these are some of the things that we need to do. In addition to that, every girl or woman should have a hemoglobin, a blood group done in early age to know
Yeah.
what the woman's blood group is and what the woman's hemoglobin is.
Because again, anemia and then the other things also follow up with immunity and stuff. Correct. Um, why do women face a lot of UTI issues? Causes and ways to prevent to treat it. What would you say?
Okay. So, as you know that the urinary tract and the vagina and the rectum are very close to each other in location in a woman. So, anatomically, there is a more predisposition for urinary tract infection. Number two is that women are more prone because the urethra in the woman directly opens into the bladder. So infection can occur very easily. And thirdly, if improper internal hygiene is not carried out, it is very easy to get infection.
Okay.
What is the simple way to prevent urinary tract infection? It's to flush out the urine. So if you have adequate amount of water,
Mm-hmm.
okay, not only will you look beautiful, because you know all your beauty tips say that I have adequate
Hydrate.
water,
Keep
hydrate
hydrated.
yourself. That's the best way that your skin glows. Okay. Similarly, if you have adequate hydrated water, it
Mm-hmm.
will flush out the urine and ensure that the urine doesn't stagnate, because you know the principle. It's monsoon time. The moment the water stagnates, malaria and other diseases start. So the
That's
germs breed. Similarly, in the bladder also, it's the same story. So you need to have adequate water, hydrate yourself, it will automatically flush out and infection will reduce. In addition to that, again, I told you internal hygiene is very important. If you use the right washes, it will reduce the chance of urinary tract infection. Cranberry is a very good herbal product which can reduce infection. And Charak has a lot of nutraceutical products in the Femiplex range, which also are excellent in reducing the risk of urinary tract infection.
okay. That's nice. Um, there is one question. I get terrible period cramps and have tried a lot of things, but doesn't work. Please share some effective ways.
Okay. So, some amount of cramps and periods are expected, but any cramps which are long lasting and which are so severe enough that you just can't get up in bed or can't do your normal day to day life, you need to evaluate those cramps. To put it scientifically, painful periods are what are called as dysmenorrhea. And there are two types of dysmenorrhea. One is spasmodic dysmenorrhea. It's like muscle spasms. So the uterus goes into spasm. And the second are congestive dysmenorrhea, where there is congestion in the uterus which causes pain. The causes are different of two. Spasm may be because of a fibroid or something like that, and congestion may be because of a hormonal imbalance causing an increase in the size of the uterus or the swelling of the uterus. So
Okay.
you need to be evaluated for these two. Rarely, it could also be because of endometriosis, where instead of the blood refluxing out, I mean, coming out of the vagina, it refluxes back and causes, cysts in the ovary, bloody hemorrhagic cysts in the ovary, and that causes fibrosis and adhesions, etc., which can also cause a very painful condition. It's often undiagnosed because you require to do sonography or laparoscopy to see them. Okay, so you need to be evaluated if it's severe. But if it is not severe, simple things like using a hot water bag, okay, doing some kind of pelvic exercises, yoga, meditation will all help in reducing the pain because it deviates the noxious stimuli away, as well
Yes.
as it stimulates certain neurotransmitters which reduce the pain. Pain relief medications are also found to be useful in patients who do have severe pain, but they should be used with proper medical advice. Uh, they should not be overused or self-medicated.
Okay.
Uh, some form of exercise, stretching, okay, will definitely help in reducing pain relief. Uh, Herbal medications like evening primrose oil, vitamin E are also found to be reducing pain. But of course, they do not stop the pain or cure the pain. They help in reducing it or alleviating.
That's great. And then someone also asked that is it safe to take painkillers during periods? So like I would like to say, Prerna, like the doctor advised, you can take it under medical supervision. That's not a problem, and don't overtake it as well, like I said.
Yeah.
All right. So, coming to some important tips, okay, that all women should follow to improve their health, like in general, and like it's like for us, like skincare, you have CTN, you have to cleanse, wash, tone, moisturize. Like similarly for women health, is there like steps you should be every day following, and that will keep you good?
Yeah. So I think that's a very important question. We need to have what is called as a health discipline or a health mantra in each one of our lives.
Mm-hmm.
Each one of us has to tweak this or individualize it as per our own body.
Okay.
Sejal's tastes and favorite color will be different from somebody else's favorite color, and so also Sejal's mantra to achieve health and wellness. So
That's true.
each one has to tweak it himself. Most importantly, you can develop it, but it will only be successful if you follow it rigorously and on a daily basis. So, like I told you, eat well, sleep well, eat healthy food with lots of fruits and lots of water. Okay, think positively because if you worry, disease is easy to creep in. Maintain good hygiene, both intimately as well as all over your body. And last but not the least, if you have certain conditions or health issues, make sure that you address them and maintain them and get rid of them as quickly as possible. Last but not the least, remember your doctor is your friend in need. So, whenever you have a health issue, please seek his advice. I'm sure he'll give you much scientific, much safe, and much successful advice as compared to your other friend, that is Google. Okay?
Yeah, Google can definitely misguide you. I think I have a big problem when people just come in with Google and half knowledge and not verified as well. That's amazing, amazing. Like, thank you for sharing so much of knowledge. Before we end up, I think I've missed on few questions from the audience, so we'll just take two, three questions, if you don't mind,
Sure.
sir.
Yeah,
So
sure.
there is one question. Thank you. There's one question where someone asked Nitya, what should one eat and avoid eating during anemia? So any dietary advice for anemic
Yeah.
people?
So I already said if you're vegetarian, have green leafy vegetables, spinach, jaggery, chana, okay, dry fruits, eggs. These have got good iron content. If you're vegetarian, meat will be having very good content. Some of the fishes also have got good iron content. So this is what you need to have. If you can't have all this and you want a shortcut, have Manol Nutra. It has all this put into.
Okay, and avoid, like generally you should avoid. I think you already mentioned also about you
Yeah,
should
but a
avoid
few things,
dairy,
few
sugar.
things, few things that will reduce the iron absorption in your body, and that is if you have food along with too much of tea or too much of coffee, because tannin and phytates they reduce the absorption, just like amla, which is vitamin C, increases the absorption.
Yeah.
So avoid these things in your diet.
Okay. One last question I think I'll take. If someone has kidney stone of 13 mm, would calcary Alka 5 work?
I didn't get the question.
If someone has kidney stone of 13 mm, that was very like person has just come to answer. Would calcary Alka 5 work?
What medication? I didn't
13
get it.
mm
Yeah, that
stone
I got,
kidney
but what
calcary Alka
medication?
5. I'm not aware of the generic term of it, but some brand name they've given, I guess. I'm not
Yeah,
sure.
I'm sorry, you'll have to talk to the urologist because they'll be
Yeah.
the best people. What the person needs to do is that on ultrasound, try to find out where the stone is, whether it's an obstructive stone or a non-obstructive stone. Has it come down into the bladder? Has it got flushed out? So they need to hydrate, get the stone flushed down as much as possible. If it's a painful situation or an obstructive situation, then maybe an intervention may be required to crush this stone or remove this stone. So I think the best thing to do is not ask Sejal or me, or it's better to go to the urologist and they will guide you properly.
That's true. And be specific about actually you should take it or not. Last questions, guys, because there are questions coming in, but I think we are also running short of time. Many a times, patients show faint positive in UPT tests. Can we consider it positive?
I think it's a very
Pregnancy
good
test.
question. So remember, it is true that at times you do get a fake positive UPT test. Okay, you have a fake negative UPT test also. So in such a situation, your doctor will ask you to do a blood test to check for the hormone of pregnancy, which is called as beta HCG. This beta HCG is secreted in the woman's body if she is pregnant. And it is when you take the blood of the woman and you check its level, it will tell you 100% if the woman is pregnant or not. So there's no false positive or false negative. So whenever we are in a dilemma, we do this test to find out whether the woman is pregnant. So in case there is a dilemma like this, go to your doctor, get this test done. For God's sake, you don't interpret it, because you will find that its value ranges in the first week from so to so, second week so on to. Let your doctor take that trouble, and he or she will guide you how your pregnancy is ongoing, whether it's in the best of health, whether there requires any special attention to be given.
Okay, I think we are done then with this last
Okay.
question, and it was so amazing interacting with you,
Sejal,
Dr.
there, yeah, Sejal, there are two things that I want to emphasize to all your fans. I believe you have close to 3 lakh fans and followers. So it's amazing the good work and the happiness that you're bringing to people with all your tips. Remember, like I told you, if somebody feels good in mind, body, and soul, I think that's the easiest way to achieve health. Okay, so keep up the good work. Um, and I'm sure that many people will be extremely happy and positive after they watch your channel.
Thank you, sir.
I want to make two issues. I want to bring out two important points
Yes.
to your fans who are young at now but will soon think about marriage and pregnancy and enjoy motherhood. Remember, motherhood is a blessing that God has given every woman, and you must enjoy it and make it memorable. Okay, and as doctors we are now doing what is called as respectful maternal care. So we give all the respect to the woman and her family, ensure that she is safe, the birthing process is successful, and the overall process is extremely satisfying. So don't be scared of pregnancy or childbirth. It is something which is physiological. It is something that you need to enjoy and cherish, because you want to, you've been given this unique gift of going to become a mother. So ensure that you are very, very involved and responsible. And of course, your partner and husband is also equally responsible. So the partners and husbands are also now a part of the birthing process. Number two, I want to say regarding vaccination and COVID. I think the best way that we can, or the only way we can get rid of this pandemic, is to get ourselves vaccinated as quickly as possible. Don't hear about the, don't listen to the rumors, don't
Yes.
believe the fake news. Okay, these vaccines are safe, these vaccines are scientific. Okay, they need to be taken properly. So as and when your time comes, please take the vaccine. In the meantime, continue with the masks, with the hand washing and the social distancing. We have people like Sejal who ensure that we don't remain distanced, because they reach us on Instagram with their posts, and they ensure that we communicate. I'm sure Sejal agrees with me that she keeps us all involved and happy with her multiple stories on Instagram throughout the day and her multiple posts. So let's live with it right now. But if we act socially responsible in these three ways that we commonly say, with the vaccine as the fourth way, okay, I'm sure that we will be able to overcome this pandemic. And don't be fearful about COVID in pregnancy, etc., etc. COVID is, even though it is a risk factor, but we found that pregnant women generally do well. So seek the correct advice, be in a positive mind state, whether pregnant or not, and I'm sure that your body will respond and you will overcome this COVID.
Yeah, definitely. That's amazing. I really love listening to this and the COVID, because now people are not still having question about, can they get vaccinated or not. And I think people have slots. We have slots in the hospital, especially for pregnant women to get vaccinated. So guys,
No,
don't
pregnancy
forget
right now,
it.
pregnancy, we are still awaiting data in India.
Yeah.
Abroad in the US vaccines are found to be safe. As and when we'll get data in India, then we'll roll it out for the pregnant women. So as of now, just hold on. Okay, let's be sure about it completely, and then. But for the rest of the people, yes, please go ahead. It's reducing your risk of serious hospitalization and serious complications.
That's true. It was lovely chatting with you, Dr. Amir. It was such like this. All tips are, I'm sure, beneficial for me as women and for everyone who's watching the live and will be seeing it. We'll be saving it on our IGTV, so those who have missed it can also watch everything and note down. And it was a great pleasure, sir, talking to you.
My pleasure too.
All right, guys, those who want to understand in Ayurved way how to deal with women health issues, they can tune in tomorrow, and Dr. Manisha will be there at Charak Pharma same time to guide you guys for that. All right, signing off then. Thank you, Dr. Amir.
Bye.